We have one more panel, and in a way it may be the most fundamental panel of all. It's about education and healthcare, which none of us can do without. Stay tuned, please. But before we had a wonderful, we were going to save her to the end, but we just want to get her in now. This is really the roots of the culture in many ways. Krystina Cárdenas is going to do a Spanish flamenco dance. She is part of the Alborada Spanish Dance Theater Company. Please, your attention. Panelists gather here.
My brother. Oh, that's so funny.
Krystina Cárdenas of the Alborada Spanish Dance Theater Company, Fords, New Jersey. Thanks very much. And again, now we have our final panel, education and healthcare. Again, probably two of the most critical aspects, really, of the whole event. And Dr. Sandra is going to come up and introduce herself and everyone else.
Dr. Díaz-Claisse here?
What's that?
Dr. Díaz-Claisse? Okay, well, in the interest of time, she's here. Okay, so in the interest of time, I think I'm going to begin. So thank you all for holding out a bit longer. I promised the organizers that I'm actually going to try to keep this to about 15, 20 minutes, unfortunately, because I know we've had a rather long morning and we're probably a bit hungry now, right? And so we want to end, and we also have some concluding remarks also from the organizers. My name is Sandra Echeverria, and I am faculty here at the UMDNJ-School of Public Health. I am a researcher, and before I begin the panel, I just wanted to make a comment about my impressions of today's session. I've been really moved by what I've heard, the personal stories that I've heard here, because for many of us, so I also attended Rutgers, so Rutgers is my alma mater, so happy to see a lot of other Rutgers, fellow Rutgers alumni also here. But I've also sometimes been kind of the solo act, right? So when I went on for my PhD at Columbia University, I was the only Latina in my department. I am currently the only Latina in my department in epidemiology, full-time tenure track faculty. So it's really hard, and when I come to sessions like this and forums like this, it's really refreshing and uplifting to see that I'm not alone, in my perspectives, although my work focuses on research, I also integrate a lot of what we've covered today. So the issues of politics, marginalization, discrimination, and how they impact health, because I'm a researcher, and my PhD is in public health. I'm an epidemiologist. So and then the charge for our panel today, so I wanted to make that comment to thank all of the organizers. So the charge for our panel today was to try to address the issues of education and health and how they impact Latinos. And we had one pressing kind of overall question that we were going to all try to address as kind of the number one issue we thought about education and or health, either through the work that we've done or just in general on how people have been what they've been observing about how education is influencing their work and any future prospects or ideas they have about how educational trajectories for Latinos. And I wanted to just also give some a little bit of backdrop on that too. And we've seen some of this, so I am a numbers person, unfortunately. We heard a little bit about this in the past, earlier in the morning. So we know that, for example, Latinos currently about 11% have completed a college education. So we saw the charts where there are a lot of Latinos entering college, but the rate of completion is actually much lower. So 11% of Latinos are finishing college compared to, for example, 22% of the overall population here in New Jersey, and only 5% hold graduate degrees. And I wanted to link this a little bit also to some of the work I do, and my research focuses on examining how neighborhood conditions, so issues like poverty, marginalization, lack of resources within a neighborhood impact health, and also linking that back to education, right? Because we know that education is linked to where we live. So where we live matters for our educational prospects, right? So we know that education is funded through our local tax system. So I wanted to have the panelists also kind of have this as a backdrop, if we can try to integrate this hopefully in the next few minutes, about what we think about that, what's going on in the state in terms of educational opportunities for Latinos, because the majority of us are living in very poor neighborhoods. Some of us are able to emerge from these neighborhoods and move on. I personally was raised in Paterson, New Jersey, the first college graduate, all other Paterson people, first college graduate, but it was a really long struggle to get here, right? So we want to try to address that and how we can try to improve this for Latinos. So I'm going to begin by introducing the panel. I think now we're all here. So on my right here is Edward Correa. There's a more complete bio on him, but I'm going to just kind of give an overview on the work that he's done. He's the co-founder and president of the New Jersey Latino Foundation, whose mission is to educate, integrate, and increase the civic participation of members in the community. He's also a co-founder and member of the steering committee of the Latino Action Network. Moving on, we have Xiomara Guevara. She's executive director for the Morris County Organization for Hispanic Affairs. Previously, she served as the center director for La Casa de Don Pedro's preschool programs in Newark, and she holds a BA from Drew University and a master's in public administration at NYU, and she's finishing her law degree here at Rutgers, Newark. Then we have Mr. Raymond Lamboy. He is president and CEO of the Latin American Economic Development Association in Camden, New Jersey, which has as its chief mission to provide entrepreneurial training for disadvantaged minority youth and adults living in the Delaware Valley, primarily in Camden. He's a second-generation owner of Lamboy Furniture Company, a family-owned business here in New Jersey. And then we also have Dr. Ivonne Díaz-Claisse. She is the Executive Director of HISPA, Hispanics Inspiring Students' Performance and Achievement. Dr. Díaz-Claisse also works as an educational consultant for Spanish Educational Resources, a division of Camera Mundi, a company based in Puerto Rico specializing in Spanish, ESL, and bilingual educational solutions. She holds a PhD in mathematics and also has a master's. She completed her master's in mathematics from the University of Maryland and a PhD in mathematics from Arizona State University. And she also participates in the Reaching Our Dream program coordinated by Save Latin America. So let's begin our session, and again, we're going to try to stay a little bit focused, so if we could all just, each panelist, maybe begin with about 5 minutes or so. Again, the general topic for our session was on education and or health, so your kind of views on how education, your experiences with educational issues affecting Latinos, either in your work or just your general perspectives on it.
Dr. Echeverria, good morning. Actually, good afternoon, everyone. It's 1 o'clock. Time for lunch.
Yeah.
My name is Correa. I'm come from Dover, New Jersey. I am actually an immigrant from Colombia. Came to this country 17 years old and done all the career as an immigrant in this country. I started doing community organizing in 2007 with the Latino Leadership Alliance of New Jersey as a volunteer, and later I served as a director of community initiatives and later community development. Development for the Latino Leadership Alliance Foundation. And then from there, I moved into the political world and later on co-founding the Latino Action Network and the New Jersey Latino Foundation, a soon-to-be 501c3 organization. Along the lines, basically, on the ground, on the street, at the corner store, at the bodega, listening to people's concerns every day, on and on, whether it's education, access to health, political empowerment, racial discrimination, civil rights. When it comes to education and access to health, which is the topic of the hour, the lunch hour today, I believe that in the next 10 years are critical, and today is critical for the Latino community in the state. But we must understand, we have to go back, we must go back to the Monroe decision, which created equal an education, not the separate but equal, but the Monroe decision created the opportunity for Latinos to move out of the slums, out of the ghettos, out of the urban areas. What has happened is when we see the reality nowadays when it comes to education and Latinos in the state of New Jersey, we see that Latinos are not graduating high school. That's an issue. But we also see that Latinos are making it to universities and they're not graduating at the numbers that they're enrolling in universities. The few Latinos, and I make an emphasis, the few Latinos that are making it to secondary education, they're not graduating, and there's a reason for that. But let's talk about high school and preschool education in the state of New Jersey first and foremost, which is the ground for Latinos to move on to greater things. In this case, move on to secondary education. I am of the belief, based on the research and based on the people that I have talked in the state of New Jersey, that the solutions to the education issue, or the education reform as they call it, are not on creating parental choice. And I said, which is a school choice. Because we got to go back to what the main issue is. And the main issue is, in education, is segregation. And I'm going to say it again. The issue in New Jersey is segregation. New Jersey is the 6th most segregated state in the United States. And despite all the progressive, quote-unquote, progressive policies in the state of New Jersey, we see segregation in the school system. But it's not segregation created by the Board of Education, it's segregation created by the Monroe decision that got it down through other legislative actions called regional contribution agreements. And what they are is a community such as Mendham, where the governor lives, the current governor, for years were able to give money to Passaic City or Jersey City or other cities so they can create affordable housing in those cities. And what that created was basically more ghettos. They created more segregated communities where Latinos now are encircled by cycles of poverty and they're still there. So yes, we can give choice to a student that lives in Newark and he can go to Montclair, but at the end of the day, he's got to go back to Newark to live, where parents must work 2 jobs, and he's going to be home alone, and there's nobody there to mentor him to do the homework. So at the end of the day, it's not a recipe for success. Yes, we're tackling the issue at one angle, yet the segregation still exists. Versus if the regional contribution agreements, called RCS, didn't come into place, communities such as Mendon would have been more diverse. Students of Latino or African American descent would have role models, and they would have been able to be raised or grown in an area with different influences and different environment. That's one of the issues. And then obviously is the issue of access to healthcare. For many years, think tanks, universities, research and scholars, they have done a lot of research, and the research basically, the pattern of the message on all this research, all these white papers has that there's a lack of access to healthcare. We know that. There's a lack of access to preventive healthcare. We already know that. And that it's not affordable for Latinos. We already know that. And that there's got to be a segment or a big component of cultural competence. When a Latino family or a Latino father and mother, they go to the doctor, they're more comfortable talking to a doctor who speaks their language, maybe understand their culture. Maybe a Latino doctor in this case will be the solution. And that will help them understand basically what preventive care is, why to do it, and all these things. Well, we know that there's a lack of insurance. We know that through the presentation this morning. We know that there's thousands of Latinos with no health insurance. We saw it this morning. At the end of the day, we're only left with what is the policy decision to make. It's all about politics at the end of the day, and we know it. Well, what legislators, whether here in New Jersey and Washington, are going to do to make sure that Latinos have more access, quality access to health care in a competent and a cultural competent manner. That is a big issue that affecting Latinos every day. There's a discussion, maybe we know it now, happening at the Supreme Court that is trying to remove some of the paragraphs from the Affordable Health Care Act, which is a direction. It's not the panacea, it's not the solution to all the health access and health disparities issues, but it's a solution in the right direction. If the Supreme Court removes some of these terms and conditions of the Health Care Act, Latinos are going to be greatly affected, because at the end of the day, they're not going to have access to high quality health care that they deserve.
Thank you.
You're welcome.
Well, good morning or afternoon as well. I'm currently the executive director to a nonprofit who provides human services in Morris County. We're the only organization in Morris County who focuses on Hispanics and serving Hispanics in the county. However, today I'm going to talk about with my passion and education that comes from my past experiences, both as a teacher in the Newark public school systems and then as a center director to an Abbott preschool in Newark with La Casa de Don Pedro. And I'm glad that Edward talked a little bit about the law, because I took educational law last semester and I'm good with not having to talk about it right now. I think when I was in the classroom and when I was the center director at the preschools, I saw a lot of different things that I would love to change. The first thing is I think everybody should have early childhood education. We don't have that now in Dover. We don't have that in Morris County because of the different school aid formulas. And I think all children should have it. I think it should be affordable. One of the reasons that that doesn't happen in a lot of the Hispanic families in Morris County is because it's not affordable to send your child to preschool or even to a daycare. Research nationally has proven that if you get a child to get early childhood education, or parents at home to start enforcing vocabulary and math, it makes a difference when the child goes into grammar school and then into high school. And I think that that's definitely one of the issues we have in the nation. It is something that we're having trouble here with in New Jersey. Every time we look at a school aid formula, preschool education is not one of the priorities for all of the children, and I think it definitely needs to be. In New Jersey, we talk about teacher quality, and we talk about teachers sometimes in a good way, and we talk about them sometimes in a bad way. I was a teacher, I was there, I know it's difficult, but quality is there, and you can train teachers to be effective teachers. They need support, though. That doesn't happen all the time. How we're educating teachers needs to be changed. How we educate our teachers here in New Jersey needs to be changed. What we're teaching them and what they need to then teach our children and how they look at our children. Cultural competency should be part of the curriculum when we're teaching, when we're educating our teachers. That doesn't happen. And I definitely think that that needs to change. It's been proven in other states like California to be very effective when you take teachers within the urban districts and then teach them to come back into the communities and teach. But that's all part of programs. They have support from their governments. They have support from national governments sometimes. Obama has done a lot to move toward that, but that hasn't really translated into New Jersey. And so I think that that's something that we need to look at. So when we're thinking about holding teachers accountable, we need to hold whoever's supporting the teachers accountable as well. And that hasn't happened. And I didn't see that. I didn't see that in Newark. I don't see that in Dover or Morristown, for that matter. So that definitely has to be part of it. Mentoring, and Ed talked a little bit about this, has to be essential to our children. We don't mentor our children. We don't mentor them at the public schools. We may have some programs that mentor, but are all of our children really being part of these programs? Not really. Are they really being able to target everyone? No. I know I've heard about HISPA, and they're doing a really good job, but they're not everywhere. And we need to have a HISPA or a program like that everywhere in all of our cities. And it's something that, at least in Dover, I've seen that would be beneficial if they see mentors that have gone through their same story. I've made it part of my life to mentor as many young Latina women as I can. I am no special. I am not special or smarter, I think, than anybody else. My career has been pushed because I knew education was important, and I've pushed myself to do it. And it hasn't been easy, but I did it. And everybody asked me, well, how have you done it? Because right now I'm a parent, I have a full-time job, and I finished law school, or will be finishing law school in May, with this full-time job. The only way I did it is because I had support systems. I have always had parents that supported education to be the biggest priority. I have the people around me, my friends, my husband, everybody has supported me in my decisions. And that's the key, the support. And how do we teach our parents to support their children is key. I think that that's the other thing that needs to happen in our education systems that should be part of the curriculum, to teach parents to be teachers at home. Not everybody's born to know what to do, how to teach somebody, how do you teach your child to learn multiplications except to tell them to memorize them? Well, no, there's other ways. Everybody's a different learner. And there are programs in California, there's various models where they've actually gone into the public school systems as part of county government and have started mentoring, and they've seen the changes. They've seen the changes in many of the youths there. So, I mean, I can go on so many other things that I would change with the education system. I feel very passionate about it. I never forget how my life was in the classroom, both as a student and then as a teacher. And even now I'm still a student. I still know when a good teacher is good. But I think that there's definitely a lot of things that need to happen in New Jersey is not addressing them. Under health, with the clients that we have now, and Ed talked about it, we hear it. There's no insurance. They're not being insured. But even when they do approach a hospital or a health facility, they need to feel like they're being welcomed, and cultural competency is still something that's not happening. We talk about it, some people know what it means, some people don't know what it means, but it's not happening, and you're not gonna go somewhere to tell them about how you feel if you don't feel comfortable. It doesn't have to be somebody that Hispanic, although ideally that would be wonderful, I think, for many of our clients, but it just has to be somebody that's welcoming and that's willing to listen. I think one of the greatest things that we've done in our organization in the past 3 years is partnered with our federally qualified health center, so our local health center, and started a health literacy program with ESL programs that were already in place and with a computer training program that was already in place. Why do I think it's important? It's important because health literacy is important. Everybody needs health literacy. I need health literacy. I don't know what to ask my doctor every time I go. So how do you expect somebody that has a language barrier already in place to then go into and ask the right questions? And so I think health literacy is important when we talk about health. Of course, getting everybody insured or somehow would be important, but I think also health literacy programs and then cultural competency are very important. And I'll stop there because I can go on any of these things for hours. So
Thank you.
Right.
I feel a little odd because I came here prepared to talk about entrepreneurship, but I just happen to be on the Board of Education in the city of Camden. So I'm on the ground. I see some of the issues around education in poverty-stricken communities and the challenges that are there. When I look at the Latino community in Camden, we represent about 43% of the student population, but the number of teachers in our schools are like at 10%. And I asked the question of the professionals, how much of a difference does that make when you have a teacher that understands you, your culture, and where you're coming from? How important is that to your education, to child learning? And then I take it to the next level and I ask the question about parents. How do you connect with a parent if you don't understand their culture, where they're coming from, and their educational background? Too many times, I mean, I've got a vast experience in being a business owner and a mentor to children and so on, and it's like two worlds that I experience. I grew up in Cherry Hill. I grew up in a very wealthy community, had the best education possible, and then I had a business in the city of Camden. My dad started in 1970. I took over in 1992 after graduating from Rutgers, and I started mentoring children and seeing the two worlds that that Latinos live in and we all live in. When a child came to the store with his homework, and he had no clue of how to do his homework, I asked the question of, well, is your teacher checking, helping you? Are you getting tested for dyslexia? Are these things? And then talking to the parent looks at you with your blank eyes. What are you talking about? So when I look at that, I say to the professionals, how are we teaching our parents about the business of education? Because in Cherry Hill, parents manage their children's education from kindergarten, preschool, all the way up to high school. My sister was an educator. She did some time in Cherry Hill District, and you had parents that actually would threaten legal action if you did not give their child an A. Where in the city of Camden, kid gets a D, they just, okay, that's the way it is, and keep on going down the road. So when I sit on the board and I look at all these issues and I look at the dollars that are being spent, I have to ask the question, how are we addressing our customer? I use my business hat. And I bring it to the table and I say, how are we addressing our customer? The product that we're selling in Cherry Hill is not what's going to educate our children in Camden, because the children that go into the schoolhouse in Cherry Hill are prepared to learn. They've eaten, they've had a good night's sleep, and they have, for the most part, a good home life to grow up in. Where the children that go into our schoolhouses in the city of Camden may have just witnessed domestic violence all night long, probably are very sick or have bad teeth, because I had children that I mentored that their teeth were rotted out, okay? Parents didn't know how to access health care, and hungry, okay? How do we fundamentally change our approach to education in the city of Camden, in these urban areas? When you take it to the state level, it's very frustrating, because it's a moving target. They say CUSAC, I forget the acronym, what it stands for. CUSAC is made for Camden, because every time they change it, they have Camden in mind. So they set up these bullseyes. They say, if you hit here, 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 you're an operating district at a high level. But then if we don't hit there, they say, you know what? How about we move these targets around and put it here, 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 and here. So here you are, I look at everything as a business. You're setting up systems to address that target, that target, that target, to start achieving at those levels, and then they change them on you, okay? So constantly, the professionals in the district are always changing, and systems are changing, and then you have that level of of challenges you have with a large organization where systems are not being followed and accountability is not there as well. So that's my education hat there. But when I look at my entrepreneurial hat, and I say, how can we use the dollars that we have to address these issues? And I look at parental involvement. I mean, parental involvement is almost nil in our school district. Very small amount, but it's so key to it all. But you have a parent who doesn't have the paradigm that they grew up in was not about helping their child do their homework because they weren't helped with their homework coming up. My father learned how to speak English by reading comic books. A teacher took interest in me. He didn't know a lick of English. Took interest in him and said, hey, look, here's a comic book. When you finish this, come back for another one, okay? So we have to look at these parents and say, how can we empower these parents to to manage their child's education? I'm also on the board of Salvation Army in the city of Camden, and we're looking at programs for our Kroc Center, and that is one of the programs we're looking at developing, teaching parents about the business of education. What are your rights as a parent, as a child in this district, and how do you hold your teachers and your administrators accountable for that? Because only when there's accountability do you get production, performance. So I leave that there. Healthcare, it's another issue. A lot of business owners, I'm a business owner. When I had my own business, I had to pay through the nose for healthcare because I was a single person. State of New Jersey does not allow a Chamber of Commerce to create a group plan for business owners. So we create, Light has been in business since 1925. We created 400 some odd businesses, 200 businesses that are still in today. But when it comes to healthcare, it's still out of reach of even entrepreneurs to get the quality healthcare that they need. Take it to the next level of the working poor where they can't access healthcare. There's a movie I watched, it was called, I don't know if anybody's fans of Walmart, but the high cost of low prices, true cost of low prices, and they actually pay, they have a healthcare program available, but it's so expensive that their line employee, hourly employee cannot access it. And what they do is they actually promote the social service programs within their counties as the healthcare program, okay? That's the kind of things that are going on out there that we need to start looking at with access. Take it another step. My experience when I finally get a business owner who has healthcare, all their experience, their engagement with healthcare has been the emergency room. Trying to get them to break that mindset of the emergency room is my primary care provider. I asked them, don't you have a doctor that you see on a regular basis? You get no, I just go to I said, you have health insurance. Don't you understand what that means? And they don't understand what that means. So as we start to gain access to health insurance, we need to educate. Health literacy, the point that was made here, is key. How do you utilize your health insurance to the highest value you can get out of it for you and your family? Because the CHIP program that the state has, which is a great program for the children, but again, parents need to understand how to utilize that to keep their children healthy. I'll leave it there. Thanks.
Great, thank you.
Oh, thank you. I thank you everyone for still being here. I have to tell you, most of them are my friends, and that's why. But it is wonderful to be here, and I have to tell you, so you know, the power of a story, right? So here I'm thinking, what will I do next? Will I be a poet? Will I start a TV show? Or should I get into politics? That's how I feel from listening to all the wonderful role models here today. And I'm telling you the truth. So how did I, why am I here, right? So I'll go back to graduate schools, pursuing my PhD, finding out that I'm actually the first Hispanic woman to get a PhD at Arizona State University. So that was my first kind of awakening, right? I never thought about it that way. I just love math, and that was it. Then going to work at AT&T in a great corporation, great diversity, but still seeing that actually by the time I left AT&T, there was no higher ranked Latinos in the corporation, and seeing the issues that we go through because of the lack of role models. And then, as a parent, focusing on early childhood education and realizing that, I didn't know any better, so I taught my 4-year-old Fibonacci numbers, and she came back to show me a poster about Fibonacci numbers. I realized the power of early childhood education. Anything I taught my children, they learned. It didn't matter how complicated it was. And then I felt, wow, does other parents know that? I mean, I know that my mom said, sometimes her parents, just leave the kid in the crib and, get going with your daily routines. I never did that. Even if my son or my daughter was in the crib, I was talking or singing or counting or saying all the colors around me. And that's just, the power of the early childhood education. Then I go to, decided that I'm going to pursue more like the consulting and educational consulting and go to the school districts. And I find out that I have teachers telling me, I have all these kids, but I have 3 that really don't know English. How do I help them? And experiencing all that, chaos that is going on in the schools because of the kind of the fast changing demographics that we have experienced. And the teachers don't know how to handle it. And many of them now, like the high schools, are saying, we have so many Latinos coming our way. What do we do? Can you HISPA come here so you can help us? And so it's really been quite an unpredictable mathematical journey for me to be here at this point where I can speak about these issues and feel confident about it, right? So if I were going to say, looking at all of that, the number one issue I still strongly believe, and I agree with all the issues that have been mentioned, and there's plenty there, but still the lack of role models to me is at the top of the list. And doing this kind of reflection to prepare for today, it helped a lot because I validated that I'm doing the right thing and what I'm doing today. For those of you that don't know what HISPA is, it's very simple. It's a very simple thing. All we do is invite each Latino professional to step into a classroom and share their story at least once a year. How simple can that be? And we do all the work. So we do the logistics with the schools. We make sure that it's so simple for you that you just can't say no. I mean, believe me that by the end of today, you all will become HISPA role models because it's very simple. It's the only thing you have to do is be committed, is to share your biography with us so we can put it on up, so students can say, oh, do I want to be a journalist? So I can read Yvette's biography, right? And so forth. And at the same time, the schools absolutely love us. Why? Because we're simple to them too. We are a one-stop shop for Latino professionals, for diverse professionals. So their career fairs don't look just one way, right? So the career days look the same way as their kids. And because that way we help them, we're teaching them. So I talk a lot about the secondary effect of the HISPA role model program, which is that we're teaching the teachers what is engineering, what is computer scientist, what is it that you do in management sciences, what is it to be a researcher at the Pew Center, right? All of those careers, we showcase them, and the whole school community is a learning process for all of us. I'm learning a lot, and I'm very lucky. I get a chance to meet everybody, I feel very strongly that we have to do it. We really, I mean, it's something we can do today. We don't have to wait for curriculum changes or laws to change. This is something we can do tomorrow, right? Literally, in university campuses. I have to reflect because we said it's all about what the real stories are. I have to reflect on where I was last night. I was at the NJIT, Society of Hispanic Professional Engineers student chapter, ceremony. These students have invited me to come to their campus, about a year ago to speak to them, inspire them. Then, I think it was only 6 months later, they invited me again. And I said, no, this is not how HISPA works. You get a different speaker. And they say, no, we want you to come again. We were inspired. I didn't know they were listening. They looked like, I wasn't sure they were listening, but they wanted me to come again. And last night, they invited me again. And this time I said, no, I brought another speaker, but they gave me an award. And for me, more than anything, is kind of a validation that this 1 hour that you spend out there showcasing your story works. It just simply works. And that's why I share that with you, because that validates what HISPA's mission is. Looking at the 10 years from now, real quick, I really think that we have to really look carefully at the English language learners. I definitely think that we cannot take care of them the way we're doing it today. We have kids that, probably many kids that are gifted children, that because they don't have the language proficiency, they're in this bucket. And that's the reason why they're leaving school, because they lost all interest in education, because they are with a group of other kids that have, different interests on education and different capabilities. So how do we take care of our English language learners? There's 10% of the kids in our schools in the United States are English language learners. That's just going to grow, and the numbers, the statistics are really unbelievable. So what is it that we're going to do? We need to have assessments for the children that are tailored to them, to their culture. We have to really go towards more individualized education. So that's where I believe one of the top numbers, challenges will be. How do we adapt to continuing to serve these changing demographics? Thank you.
Thank you. So before we open for comments that you may have, I think there are two maybe takeaway messages that I've gathered from all of the discussants, which were fantastic. So one is, I think, this combination, right, this idea that we really need to try to work on policy level changes, right? So kind of the macro level changes to try to improve educational outcomes for our children, while at the same time doing kind of the more one-on-one grassroots community outreach, because both of them are essential, right? I think to your point right now, there's small steps that we can do that can make a difference. There may be someone in the room that's sitting there thinking about becoming a mathematician and didn't know that it was a field, right? I discovered my field later on. I thought I was going to go to medical because that's what you knew, right? And pre-med. And then I discovered public health, and it became my world, and I could integrate health and politics and advocacy issues that I cared about. So that those initiatives are important. But then I think also for the organizers, for those of us who are involved, or people who are involved at a much broader level, we also need to try to work on the political side, right? Laws, policies that directly influence children in the state of New Jersey and their educational possibilities. So I think both are necessary. And then I think another point that was raised, and it's also crucial, that as we look at education, we also need to link it back to social factors that are involved with education, right? So it's not just kind of the silo approach to education. Education is also linked to the children's environment and where they live. So just one more statistic, right? So in the United States overall, 69% of Latino children live in neighborhoods that are poorer than their average worse off white children. Right? And so some of this has been named the double jeopardy of Latino children, so that you're born into or live in a family in poverty, and then you also live in neighborhoods that are poor. So imagine the double kind of challenges you have, right? You're coming from a family that may not know how to instruct you to move ahead in your education, and then you're also living in a neighborhood, and directly to your point, Edward, that is segregated, that is poor, that is going to give you a poorer quality education, and you have to overcome those challenges to be able to succeed and do well and move on and be admitted into college, and then have the learning skills and abilities in college to be able to move on to graduate school, for example. So this issue of being able to link education also to the other social factors that affect our children, and not only where they live, but even nutrition was raised here, right? That children are facing poverty, they may be coming to school hungry, and how do we integrate all of these different factors to ensure that our children have these opportunities? And then, of course, education also impacts health, right? So we know also that if you look at any health outcome, whether it's diabetes, smoking, if you look at each of these health outcomes by educational level, those that are least educated have highest, for example, prevalence, right? So the largest proportion of people that will smoke, that will be diabetic, will be those that have less than a high school degree, even just a high school degree. And you almost see this really clear linear trend across these categories with decreasing disease as you increase education. So thank you, everyone, and we want to now open the floor for questions.
I'm here because we just recently, when I was an intern actually last year, we started a program geared towards And we tried the newspapers, we tried, meeting them, but us, the Latinos, we're very hesitant when it comes to our personal information. Oh, you don't need to know my name, you don't need to know my address, you don't need my phone number. So my main reason for being here right now, standing in front of you, is that I wanted to know if you guys have any ideas on how we can better reach the Latino community. We have a program coming up May 1st, and we need at least 10 people to sign up. We have 3. And we can run this great program that offers entrepreneur training for small people interested in starting their own business. But if we don't have two numbers, we work with grants, under grants and all that. So I was wondering if anybody has any types of suggestions, because as big as the internet is, the social media, the Twitter, and the Facebook, it's not working with the Latino community. So what can we do? That's basically my question. Sorry to go it on this panel.
Well, my first recommendation is to look for an organization that might be interested in your information and have them be the advocate. So partnering with that organization, maybe if you have students that, student organizations that are seniors that are about to go out in the real world, and, just find those organizations and partner with them to offer that. Mm-hmm. Yeah. So we can talk afterwards. I'll give you some names of organizations that might be interested on your program.
Great, thank you. Are there any other questions from the audience? Yes. And maybe we'll do this one final
My name is Raymond. I'm the Assistant Director for Recruitment at the University Institute of Technology. And that Ivonne is addressing the issue of education, and especially the STEM fields, science, technology, engineering, and mathematics. Tremendous opportunities in this country. But the students, the Latino students that go into those fields are microscopic. On top of that, when they go to the community college, or when they go to universities like HISPA, unfortunately, these are students that they have also not only academic deficiencies, but in my opinion, they have psychological issues that no one wants to address. For example, there are students that go to the university, they know that there are tremendous opportunities. We have this incredible organization called the Society of Hispanic Professional Engineers, and they don't participate. They don't go to conferences. They don't want to go to meetings. So there has to be an issue, because otherwise there's a disconnect of here is you're in college, getting this incredible education, so you can get this most amazing job. In front of you, there's an opportunity to go to a conference that can offer you a summer internship earning $500 per week. And you say no. It's like they are seeing, but at the same time they are petrified of the unknown. They are petrified of discussing with someone about the opportunities that they can help themselves. So we have to address that issue as well. That yes, we can have college students, Latino college students. They are not graduating, but at the same time they are having these issues. And that is something that we as a country we are not discussing, because we are the perfect, the politically correct society. We don't want to discuss these issues. They are taboo. Someone else has to resolve that. And who is that someone else? Do you believe that Uncle Sam is going to descend from heaven to earth and knock the door and say, here, Latinos, we are going to help you? We have to help each other. For example, last night we have this wonderful banquet. We invited professionals to come. Right? They don't participate. So we have major issues that we have to be at one with each other.
Just to add to Carlo Magno, there's over 3 million jobs today that are not being filled in the United States because of the level and high skill professionals that are needed for those fields. And part of the initiatives that we do through HISPA is to have a day, like a one-day event called a youth conference at Princeton University, where we bring the students from Perth Amboy, Newark, and so forth, and we expose them to hands-on opportunities to experience these careers and to see that pursuing these careers is cool, and it's not just no, I cannot do it, or it's not cool to be a scientist or an engineer. We get like the coolest people around to come and talk to the kids. The cooler, the better, because we really want to make the point that it is cool to be smart and to work hard in school.
Sure. My name is Michelle Redfield. I know Xiomara. I've been overwhelmed, I think, with all the information I've gotten today. I'm grateful to have been able to come here. Just like Dr. Ivonne, right, I'm thinking in my head, I'm like, what should I do when I leave here? And I guess the question really goes to the Institute and the Center for Latin American Studies at Kazam. Is there an opportunity for people that are interested in continuing the conversation, or multiple conversations that have begun here, for us to maybe have like an online forum, or possibly even meet up, like on meetup.com, and have smaller community-wide, I guess, discussions where there are plenty of Latinos in the state of New Jersey that are not here today that would really benefit from being part of this conversation. And that's, I guess my question to you is there a way to link up with all these great minds that I've heard comments and discussions about today so that we can sort of continue this? That's my number one question.
So let's see if maybe some of from the organizers.
Well, I would say, first of all, every single panelist here represents at least 5 or 6 incredible organizations they're working with. And I think the idea that everybody's expressed is there just is a lot more power and collective energy. The Hall Institute, we're going to have this conference on video. It'll be on YouTube. It'll be on our website. Definitely check into that. As far as having a meetup group, I think people kind of can circulate their emails. Again, in terms of policy, it is ongoing. So write to us, and we can farm you out to other folks that can, if they can help you, they can help you, because everybody here is here because they are helpful people. Otherwise, they would not have given freely of their time. But yeah, this conversation has to never stop. I think it always has to keep going about how do we really make this society more just, more peaceful, more equitable for everybody from the day you're born until the day you die. And that's wow, that's a few centuries worth of work, but that's what the Hall Institute does, is we just get people to talk about this. So let's keep the conversation going. Write us, and then we'll certainly get your word out to everybody else, and then see where it goes from there. But I guess also, you could probably pick one of these organizations that people have represented on all the panels and spend a lifetime at this point, trying to achieve their objectives. And maybe that's just kind of the way it has to be done too. I don't know. Thanks.
Thank you.
I think our panel session is done. Thank you so much, and thank you to the panelists
you.
again.
Thank you.
Yeah, we do training programs.
Thanks a lot. This has been the Hall Institute of Public Policy, a forum on the state of Hispanic New Jersey in 2012. And looking forward to your comments and continuing the conversation. For Georgie Hall, the founder of the Hall Institute, for Michael Rickards, the executive director, for our video crew, Jen and Chris, for BJ Richards, our new media director, and for the Center for Latin American Studies at Rutgers University, thank you, and we'll see you again.